Hi, Vikram.
Hey, hi, Parul, and welcome back. But
Thank you.
last time we spoke a lot about uh, the three critical things, and we covered one aspect of it. What are the
Correct.
two other important aspects in your practice?
So the second thing I would say is systems optimization.
Mm-hmm.
A practice is a large, living, breathing organism. And if you think of the human body, you have many systems, and all those systems have to interact with each other, behave with each other for homeostasis, for a state of health. And I look at practice the same way. Now, there are internal systems, which can be clinical, that are managerial, external systems in which you are dealing with vendors, referring doctors, the community at large. And again, each one of these aspects that we've been talking about, as you know, we could talk for a week about all of them, right? So I'm going to just outline some examples of systems here. How are your schedules being set up? We have something called schedule engineering in my practice, where we schedule by doctor time and assistant time to make sure each and every person's time is utilized really well. The other are some inventory systems that we've been trying to really streamline over the past few years. This is one of the harder parts. Are you just ordering things as and when you need them? Do you know how much you're spending each month? Are you developing relationships with vendors and able to bulk order to, get the most bang for your buck? Other examples could be merchant costs. Are you a practice that is using credit cards? Are you looking at the market regularly? Are you looking at new services that might be able to help you in this area? How is your data input into your own management system? Is that clean enough? If you were to run financial reports, patient reports, will they be accurate? Will they give you the information that is there? Or it's just throwing some garbage out at you? Example for this would be a patient is referred to you by a friend, but your staff puts in just the name of the dentist as the referrer. So you really have no way of knowing, where your ROI is coming from, your most ROI. So that's very important. Clinically, you could have systems around finishing cases on time. And I'll share with you, one example of a lab flow that we just changed in the past 2 months. We moved for our expansion appliances to laser sintered 3D printed bands. Essentially, what it does is it takes away one appointment, so no separators. The fit of the appliance is perfect. I have saved myself assistant time, I've saved doctor time, I've saved chair time, and it is more convenient to the patient. They don't have to make two visits. So essentially, when we look at things like this, if we continue to revisit them, we are constantly optimizing these. It is like servicing your car. If you don't service it, it's going to have a breakdown and it's going to be expensive and inconvenient and very, very annoying.
Excellent. That's a very vital point. So, so I'm going to pause here. Yeah, Parul, that was great. I think some of those aspects are very important from a practice perspective, and I see this. The point you made about the practice being a living, breathing organism. It's very true. It's. I think everything has a persona of its own. So, what's point number three?
So, point number three is recognizing the dynamic nature of success. Success is not owned, it is leased,
Mhm.
and rent is due every day. So I came across this information. It's called the knowledge doubling curve. Until the 1900s, knowledge doubled every century. As of 2013, it doubled every 12 months. And the prediction is that we are headed into times where it will double in 12 hours. So this is your playing field. And if you, besides certain foundational aspects, if you think that what you did in the first year of practice, you're going to do exactly the same things in year 5, I don't think we are talking about success here. We are talking about relevance. I don't know if you will be even relevant at that point. So 3 things, your clinical skill set, your technological know-how, and business acumen. If you are not actively seeking to know more and to stay current in all of these, you are going to fall behind. And the idea is, to be ahead of the wave is great. If you can't be ahead of the wave, at least ride it, don't go under. And this would mean investing time, money, for yourself and for your team, not just for yourself. Your team has to be on board with this. In learning new skills, knowing about new technology. And there are two aspects: you information gather, and even if you can apply, I would say 5 to 10% of what you're learning, because the application and execution part for any new information is hard, you're still going to be okay. You don't have to go to a lecture or, I don't know, find out about Bitcoin or blockchain and, now what about dental practice? What about cryptocurrencies? You don't have to go there. That's not necessary, but know what's coming your way. Also, I know this is a very competitive field, but make sure you have your colleagues back. Make sure they have your back. You learn a lot from each other. And my father has always said this to me, he's an orthodontist, that two things: there's room for everyone, thing one, and thing two, every person you meet is a potential patient. So taking from that, you can learn from everyone. So I would invest my time in knowledge, making sure you're current.
Great, Parul. I think it's a great point. And I think for those who don't know, your father, Dr. Taneja, was one of the pioneers when it came to orthodontics in India. So it's good to have that kind of a vision and co-opt more of cooperation. That's what you're saying, among orthodontists or among them.
Right. So he has associates who, people who work with him, people who opened practices literally across the street, and he'll still have chai samosa with them. There's nothing. They're his friends. He loves them. They respect him. He's never ever treated a colleague like a competitor, competitor in a sense that I'm not going to share this or I'm not going to tell them information. And I think, there's someone above who watches over you when you do the right thing. So.
Excellent.